So one really helpful model that we found that we always like to introduce at GlobeMed is the cliff analogy for social determinants of health. For those of you who haven't seen this before, I'll just explain it quite briefly. So on the left here, you have people, that's all of us together, and then the cliff on the right is ill health. Once you go over the cliff, that means that you're experiencing disease or injury or something. For those of us that are in pre-med or in the health sciences, we're looking to prevent people from going over the cliff as much as possible, and then once they do, treating them when they reach the bottom. So there are three different kinds of prevention that we use to treat people when they encounter the cliff. The first is primary prevention. So the fence that stops at the top stops people from ever falling off in the first place. This is things like vaccines and immunization to prevent people from getting sick. It could be things like literal fences, so that if you recognize a harm in an environment, you're taking steps to prevent people from being injured by it. The safety net, which is halfway down the cliff, is for early detection. So if you think of things like breast cancer screenings, you go into your doctor once a year for your annual checkup, just taking stock of your own health, knowing your own limits and not pushing yourself to the point where you get injured. Tertiary prevention is actual medical services. So when you have caught a disease, when you have experienced an injury and you need to take an ambulance to a hospital, you need to see a doctor, you need to be admitted to a hospital. These methods become more and more expensive as you go further down the cliff. It's much cheaper and also much more effective to, say, vaccinate everybody against a disease instead of treating everybody once they actually get it. So seeing this analogy, keep in mind what are some of the factors that might lead to someone falling off the cliff? Why might they be closer to the cliff than further away? And what is it that leads to this cliff existing in the first place? With that, we really want this session to be fueled by you guys talking to each other. And so we're going to break out into our first discussion groups. Maria, if you go to the next slide. So I've given you guys just a brief overview of what the social determinants of health are, like what they sound like, what kind of things we might be talking about. We'd now like you to sort of come up with examples of things that you see in the world around you that might lead to people having different health outcomes. We're going to drop the breakout room notes in the chat. So once you're in your breakout rooms, please fill out any responses that you have into the corresponding breakout room number in the table over there. And we'll come back in 5 minutes to hear back from all of you.